you will have other opportunities to do so. A little bit about our schedule for the first half of the meeting this morning. We have a bit of a presentation where we would like to present some information about youth substance abuse, the scope of the problem, and a little bit about best practices in terms of what does and doesn't work in order to address issues of youth substance abuse. And at about 8:30, and I will move to the corner here and be the timekeeper, we want to open up for discussion, question and answer, comment, and so forth, and hear from all of you. So, and then we'll just take a couple minutes at the very end to wrap up and let you know about another upcoming opportunity to do some collaborating. So, technical information, I think those of you who have joined us online already know that if you can mute your speaker, your phone, or your microphone on your computer, we'll have better sound quality during our presentation, and then we'll unmute folks while we have our discussion. If you are online, there is a chat box. If you hover your cursor at the top of your screen, you'll see a little chat icon, and we have our substance abuse prevention coordinator. It's at the bottom, Jen. Okay, thank you. Jen Hemingway is monitoring our chat box for us. So if you have questions during the presentation, you can log those in and we'll make sure that we get to them. And when we open up for discussion, if you're with us on the phone, since we can't see you, you'll just have to jump in. If you're with us online, you might want to pose your question in the chat box and then we'll know to call on you. So thank you all for being here. For those who are in the room, if you need a restroom, it's in the back corner of the room. And there are goodies and so forth on the back table if you didn't have a chance to get them when you come in. So a little bit about our presentation this morning. We all know that it takes a village to raise healthy kids. And one thing we want to be sure we do today is to acknowledge the great support that many of our kids here in Lincoln County get from folks in our communities, and the great efforts that many of you here in the room and with us online are already making to address kids' risks and issues around substance abuse. Healthy Lincoln County is your community health coalition. We are one of 27 Healthy Maine partnerships around the state doing public health work at the local level. And we're interested in supporting you, our schools, our law enforcement, and our communities in addressing issues on a wide range of health and wellness issues, including drugs and alcohol. Right now, Healthy Lincoln County has a big opportunity over the coming year with you as community partners to hopefully bring some long-term, significant federal resources into our communities to help strengthen and sustain efforts that are already happening here and create some new strategies to help our youth and our parents when it comes to substance abuse. And so that's one reason we've invited you here today, is to hear from our coalition what is already happening and hear and talk about some ways that we can strengthen our efforts together. We have with us today a consultant or mentor, if you will, who will be working with Healthy Lincoln County and our community partners over the next several months to help us do this in a way that really speaks to our local culture and our local community needs, but also taps into some of the research and best practice experience in the field of prevention. So today's presenter is Joanna Morrissey from 21 Reasons in Portland. 21 Reasons has successfully mentored 2 other rural coalitions like ours, bringing federal drug-free communities prevention funding to communities like ours. 21 Reasons program has also been recognized as one of the top 9 coalitions in the country in its ability to do community organizing in order to bring folks together and actually reduce youth substance abuse and use. 21 Reasons is the recipient of the National 2011 Exemplary Award, the 2012 Service to Science Participants, and the 2013 Evaluation Capacity Building Grant from the Center for Applied Prevention Technologies. And Joe is the program manager for 21 Reasons and a 2012 Prevention Award winner. So in a nutshell, they've been doing this for a while. We know they're from the big city, but they understand rural communities too.
Hold that.
And 21 Reasons is pretty good at what they do, and so we're grateful for their mentoring and their work with us around best practice and research that we know works across the country to reduce youth drug use and risk. So without further ado, I'm going to do a real quick introduction around the table, and with those online, we'll test our technological abilities here. I'm Brenda Hamilton. I'm the Director of Healthy Lincoln County. We're based out of Damariscotta, and I'm very happy that you're all here.
I'm Joe Morrissey, 21 Reasons in Portland, and I'm here to help.
I'm Randy Maker, with the Lincoln County Sheriff's Office.
I'm Helen Gisler, I'm on the board of the Community Resources Council. I'm also on the RIDE board for about 6 years.
Excellent.
Susan Wilson, president of the Community Resources Council.
Good morning, Holly Stover. I'm a member of the Community Resources, and I also work in Augusta, in the Department of Health and Human Services and Communications Office.
I'm a program coordinator for community health and education for Lincoln County Health.
My name is John Bracken. I'm the sheriff.
Excellent.
I'm Lisa Moran, social worker at Wisconsin High School, and I'm also a licensed alcohol.
Excellent.
Harry Hatch, I'm the school resource officer for the Wisconsin School District.
Great.
And I'm Chris Jones. I work for the Restorative Justice Project of the Coast in Lincoln and Saginaw counties.
Terrific. And back in the back corner, Jen? She's doing technological things at the same time. And folks online, I know we have Ricky Waltz. Ricky, are you still on mute?
I'm here.
Hi, Ricky. Why don't you introduce yourself, say where you're from?
Ricky Waltz, school nurse at Lincoln Academy.
And others online?
Hi, this is Robin Hetzler, project coordinator from 21 Reasons in Portland.
She's also here.
And Jen, you said we have somebody on the phone as well. And I'm not sure we can hear the person on the phone.
I believe.
That was me.
Yeah, Robin.
That's Robin. Yeah.
Terrific. So everybody else is online. All right, take it away, Joe.
Oh my gosh. All right, pressure.
Pressure, this is you.
No pressure. Well, thank you all for having me here today, but also I just want to say how impressed I am at what short notice Brenda and Jen can fill a room for such an important topic. So I'm going to go over first, we're going to go over some trends in Lincoln County. And I know just from looking around the room, this is probably not news to any of you. But in order to lay the groundwork of what the problem is and where we're going to go, I'm just going to blast through some data that I pulled off of the Maine Integrated Youth Health Survey. Perfect time for coughing. According to the 2013 Lincoln County data for the Maine Integrated Youth Health Survey, approximately half a kid out of 10 is using prescription drugs in the past 30 days. 2.5 out of 10, or 3, are smoking pot or drank alcohol in the past 30 days, which are about on average the same across the state. This is not standout data. One of the sort of bellwethers that we go through when it comes to discussing or looking at the risks that which direction those data points can go in is ease of access. Those who report ease of access to any of these substances are at risk for using them at a greater rate. So in the next slide here, we have the ease of access that kids are reporting that they have to alcohol, marijuana, which is about 6 out of 10.
So is this statewide data or is this?
This is just Lincoln County. This is Lincoln County. Yes. Yeah, no, I've tried to make this as pertinent to you here on the ground in your own community as possible, but that's an excellent question. Thank you. And then also in regards to access, kids, as you know, just can't walk into a liquor store. So where do they get it? Most likely it's from somebody that they know. And so in Lincoln County, 4 out of 10 are reporting that somebody gave it to them, as opposed to them just stealing it out of a cabinet, which is telling in many other data points coming up. I like to look at certain data points, not just as a snapshot in time, but as a trend over time to show you where you're going. And this is, you can see from 2009 to 2013, you guys have been doing a great job about limiting youth access to alcohol. But there are forces of change that are happening in our community here, as well as in the state of Maine, as well as across the country, around the norms around marijuana. And you can see where these two data points are going to cross probably in 2015. And I'm sure for those of you that are working in the school districts, you've seen this probably firsthand. The effects of youth's ease of access and lack of perception of harm for marijuana. And that brings us right to 6 out of 10 youth in Lincoln County in grades 9 through 12 say that there's no risk for smoking pot 1 or 2 times a week, compared to drinking alcohol 1 or 2 times nearly every day. So as you can see, the perception of risk for smoking pot is less than for drinking alcohol for our youth. Also, as an aside that goes along with this, I just didn't want to bore you with more data slides, but there's 20% of youth in Lincoln County in grades 9 through 12 report no risk for binge drinking. 54% report no risk if people smoke pot regularly, which is undefined, which is why I didn't bother putting it in a chart. But over half thinking that there's no risk for smoking pot regularly is an issue. And 11% report no risk for taking prescription drugs not prescribed to them. In the family domain, or for those of you who don't do public health ease, for those kids talking about what their family life is like, 2 out of every 10 report that their parents don't feel it is wrong for them to smoke marijuana. Conversely, 1 out of 10 students in Lincoln County in grades 9 through 12 report their parents don't feel it is wrong for them to drink alcohol or to take pills. So even though it's not a big number, twice as many kids think that their parents don't think it's wrong for them to smoke pot than they do for their parents. That's their perception. That's their perception. But as I like to tell my children, perception is reality for a lot of these kids. If they don't think that their parents, for some, but if they don't think their parents think it's wrong, or if their parents smoke it daily, or, right. So if a kid doesn't think their parents think it's wrong, that perception of feeling that they're going to disappoint their parents, which is a huge protective factor for a kid's behavioral choices, is missing in that kid. 8 out of 10 report that they have parents who try to help them and succeed, and a family that gives them love and support. So although there's risk for the perception that their parents think that certain things are wrong, that's a really great number, that 80% of kids in Lincoln County feel that they're well supported in their families. And that is a resource that we can capitalize on moving forward. And just additionally, a little over half report that their parents are good at talking to them about things. That's just how the question is phrased, about things. And that more than 3/4, or 86%, report that their parents had clear rules about alcohol, tobacco, and other drugs. So those are good numbers. I think we can improve on those numbers, but they're a really good starting point. For the school domain, this may not be a surprise, again, for those of you who work in school buildings, but in 2013 in Lincoln County, this is not any one particular school, but Lincoln County wide, 3 out of 1,000 students reported that they were drinking alcohol at school. And 15% of students surveyed that they said that they were drunk at school at least once in the last year. 3 out of 10 report that they were offered, sold, or given drugs on school grounds in the past year. Additionally, a little over half report that schools enforce rules fairly. A little less than half, about 40%, said that adults do address conflict, negative language, and bullying in positive ways to help kids. So that's about 40% of kids think that adults intervene in a positive, helpful way. 40% is good. I think that we can work on improving that. The protective factor for kids feeling that they're safe at school is, as you all know, quite important. And then a little over a quarter, or 28%, report that they have been bullied on school property or feel so sad that they stopped doing the usual things in the past 12 months. And again, for those of you who work with youth, you know that the connection between feeling that you're being bullied or depression does have a link to self-medication or seeking an escape. So those are other risk factors that lead into some of the reasons why youth use. In the community domain, 3 out of 10 report that adults in their neighborhood do not think it's wrong for them to drink alcohol. So 30% of kids walking around don't think that adults would care if they were drunk. Just not adults that are related to them, but their neighbor. And that 5 out of 10 report that they see tobacco industry advertisements in their local stores. And I'm going to get to advertising a little later, but you know, the saying goes, advertising works. And I'm bringing tobacco up as a bellwether because tobacco advertising in stores has been banned for youth in certain locations because they've shown that youth who are exposed to tobacco advertising are more likely to smoke. The perception of being caught. A huge protective factor. Yes. Yes. And unfortunately, that's the way the question's worded. So I didn't want to reword the question for the slide, but correct. So that's a good thing. But it's only half. Right. So only half feel like their parents would catch them. And then the other 80% of students, or 8 out of 10, feel that the police wouldn't catch them. Now, I know we have law enforcement in the room, and I want you to know that 80% is about the state average. 80% of youth in the state of Maine, as well as the 80% of youth in Lincoln County, don't feel that law enforcement will catch them for using alcohol, tobacco, or other drugs. And that's something that I have actually been working with the underage drinking enforcement task force to figure out ways statewide that we can come together and work on that as well. So that's something that hopefully we'll be working with a little more in Lincoln County through the UDL task force, as well as across the state to see what we can do. And at risk of boring you with one more data slide, in the community domain, or for those sort of the cultural norms within Lincoln County, 2 out of 10 report that drinking and smoking marijuana is seen as cool, and that taking pills is wrong. So that's a mixed. 2 out of 10 think it's cool, or 20% of youth think it's cool for, yes. There are opiate-specific questions. I did not pull those for this presentation. Those data points are single digits below 10%. So, and that's a really good pause clarification at this point, which is, although prescription drugs and opiate use is prevalent in most communities, what's important moving forward with the Drug-Free Communities initiative is that the roots of substance abuse and addiction reach down into 11, 12, 13, up to 18-year-olds. So for those youth, for adults who report being addicted to all kinds of substances, including opiates and prescription drugs, those addiction habits started in their youth And most likely they started with not the opiates, but with the alcohol and the marijuana, because it's the most available and least barrier to get to. And it's also, they're kids. It's still pretty scary, thank God. But that's just a really good, because there's a lot of, that doesn't mean for those youth who do become addicted to opiates because they had surgery and they were given, okay, I'm having a senior moment, thank you, OxyContin, doesn't mean that that's not a reality for them, but they are by far the minority in the population. And we're talking about doing broad community strategies to address the most prevalent substances of abuse.
Do we have statistics on the parents?
We do, and I have not included those in this presentation.
How they relate?
They absolutely do relate in a very connected way. We have, for data that's collected so far in Lincoln County, casual surveys that were sent out through the community. And as a survey taker, you could identify either as a parent or a guardian or a school worker. And Jen, do you have more to say on that? Oh, thank you. So the question was, do we have survey data or any other data points from parents and their attitudes and behaviors and knowledge around underage drinking and drug use in the community? And the answer to that was at a limited amount at this time. In other communities for which we have done this type of work with, we've used the grant money to do formalized, randomized phone surveys. Those survey instruments have similar questions from other communities. So you can take a temperature of how your community is doing, but if you use that similar survey, you can also then compare how your parents are doing to other parents to find out which is more of a normal and which is an anomaly that we need to address for this community. Does that answer?
Yeah, I just wondering if they wanted to. If 8 out of 10 parents are also taking marijuana as their children.
Well, yes, and some of the other questions that are in that phone survey are around parents' attitudes around underage drinking. How dangerous do you think it is, and how risky do you think it is? And then you line it up to the kid's perception of their parents' risk, and it often matches. I know that we just completed an incredibly. Did I forget to repeat your question?
Yes, you did.
I did. I just caught myself. It's morning. The question was, do the students' perception of their parents' attitudes, are they reflected in the reported attitudes of the parents in those surveys? And the answer is typically yes.
What percentage of youth participate in the survey? Have any idea?
Well, because of the efforts of Healthy Lincoln County, oh, I'm so sorry. That's okay. Just keep beating me up. The question was, what percentage of youth in Lincoln County participated in the Maine Integrated Youth Health Survey in 2013? So the answer to the question is, because of the efforts of Healthy Lincoln County staff, they browbeat a lot of building administrators.
It's Annie Pat McKinney, don't look at me.
Annie Pat McKinney. They begged and sweet-talked a lot of building administrators so that there was 100% participation in the schools throughout Healthy Lincoln County's district. And I do believe that we have an agreement for 100% for the 2015. Yes, Brenda? Yes. So that it's valid as far as the percentage of students, whether it's representative of the county. Was that your concern? So the Maine Integrated Youth Health Survey that we tapped for this particular presentation was grades 9 through 12. In Healthy Lincoln County, we have data for grades 7 through 12.
So there's a middle school version and a high school version of the
So that you're not asking 11 and 12-year-olds about their heroin use, basically.
Part of the reason I ask is the survey seems to indicate there's been a significant decrease. If we're more in line with saying that traditionally Lincoln was
Lincoln, Knox, I'll sort of.
So the
respond and-
concern was whether Lincoln County was on par with the rest of the state, whereas in the past, there's the perception that Lincoln, Saginaw and Waldo were among the highest. Knox.
Not the perception that the survey that private education used to do.
Right, so I'll respond to your question and summarize it at the same time real quick. The survey that has been done has changed from the MyDOS to the MyPass. So so it's a little hard to compare data to data. And so that may be some of the difference you're seeing in baselines, Todd. And the other issue is that in the past, the data we've had to look at here in Lincoln County has been regional data because we didn't have enough participation here in the county to be able to look at data that was valid just for our county. So we looked at our 4-county Knox, Lincoln, Waldo, Saginaw Public Health District. And so now that we're looking at baseline data specific to Lincoln County, the numbers may look a little bit different. So I'm not sure I would go to say there has been a decrease. I think you'd have to parse the data really clearly to try to figure that out.
And then Lincoln County, you kind of want to look at that if you have the right passwords. And you can look at
The school administrators can look at their
So
own
for those
data.
on the line, we're discussing the level of regional data versus school data, and it's all accessible. But I just want to underscore, because we're doing a countywide effort, we're looking at countywide data, and that we do have, I believe, in 2013, as well as moving forward in 2015, a representative data set for all the students.
So I would validate Sheriff Brackett's observation that Knox, Lincoln, and Saginaw tend to be some of the higher counties in the state in terms of use. I think that we may be trending down a little bit, but not that much.
And I can tell you that.
No, I think anecdotally we're all in a place where we say we're not trending down. I would take this as a new baseline and let's measure our progress forward. Yeah. Yeah. Good.
Good. Okay. So for those of you who already know a lot about adolescent brain development and the effects of alcohol on adolescent behavior, this may be a review, and you'll probably be able to even fill in some blanks for me, but just so that I can be sure we're all on the same page for language and baseline understanding, I'm just going to walk through some really basic facts around how the adolescent brain functions or doesn't in some regards. So up until about the age of 11 in girls, because they mature earlier, and about the age 12 in boys, there's an overproduction of the number of synapses in your brain. Your brain is just making wires and connections incredibly fast. And then as soon as puberty hits and that chemical balance in your brain starts to change, what happens is those pathways that get used the most become strengthened. The pathways that have been created up until adolescence that don't get used tend to fade away and wither, so that the adolescent brain is ripe for becoming what it's going to be as an adult. And the pathways that you use the most, say studying music or learning a language, become easier to do at this phase in your life. Because of the process in which your brain is forming its adult functioning mechanism, it also becomes ripe for learning addiction, just as much as you would be able to learn higher math, language, and music at this age. Which is why we know now more, because of brain imaging technology, around the way the adolescent brain works, and why it's even more important than ever before, or why we know it's more important than ever before, to try and keep adolescents away from using drugs and alcohol, especially as coping mechanisms or mechanisms to learn social skills, because then they won't learn those other coping mechanisms or healthier social skills. And that leaves you open for abusing drugs later in life. So and I did not do that eloquently, and if you all wanted to add to that, I'm open, but I think that's the basic gist. We do know from these two longitudinal studies that were taken from 1991 to 1992 and then compared to 2001 and 2002, two national snapshots of asking adults with alcohol use disorders when they first began using drugs and alcohol. And to a T, the 60% mark is the 60% of adults who were questioned said that they had alcohol use disorders. And then the report on the bottom is when they began using alcohol. So you can see 60% on the left, the green line trends have a family history of alcohol and use disorders. Those adults who were asked if they had alcohol and use disorders, 60% who said yes, reported using by age 13 and 14. And then you can see as the scope drops, 20% of adults who said they have alcohol and use disorders report using at the age of 21. And these trend lines are the same whether someone has a family history for alcohol use disorders or whether or not they have a family history. So although there is a genetic connection, it is not as strong as the connection between when they first started using alcohol.
I need to apologize. I have to go and have a good day.
Thank you for stopping in.
Thank you so much for stopping.
We'll be in touch.
Before I go, $15,000 JT400 grant gave to wraparound fund to pay for adults who are used for treatment for it's a mental health and substance abuse. Pay for both mental health outpatient, substance abuse outpatient, intensive outpatient, and all of that institutional for so anyway, just to
thank you.
We have a $15,000 grant. We'll be doing a press release after the holidays.
That's awesome.
Use
At the hospital.
Whoa.
Yeah.
Yeah, it's a wellness holistic initiative. But I don't know why, I don't know who funded them to do that, but we have $15,000
To get
$15,000 at Booth Bay Community Resources
to get people treatment, right?
for treatment for substance abuse and mental health can include medication. And then there's a 1.1 million Paul Cologne grant through the
That's at Lincoln Health.
Lincoln
In
Health
healthcare.
for holistic wellness.
Yeah.
Thank you so much for joining us. I'm sorry, because of time, I'm just going to keep pedaling forward here.
Go for it. It is 8:35.
Yes. So European binge drinking rates, for many folks, I've been doing this for a long time, and almost always there's someone in the community who I'm doing presentations to that say, why can't we just teach youth to drink responsibly? They do that in Europe. All the kids in Europe have wine with dinner. I'd like to point out that European countries, 35 of them, began taking a similar survey to the MIHAS because they were having such trouble with underage drinking and binge drinking. And this is the results of those surveys. As you can see, for every red Solo cup, it's 10% of kids are reporting binge drinking in the past 30 days for 15 and 16-year-olds. So you can see for Denmark, that has a minimum legal drinking age for 16 for beer and wine and 18 for liquor because they're trying to be responsible. They're reporting 10, 20, 30, 40, 55% of 15 to 16-year-olds are reporting binge drinking at least once in the last 30 days. That's a lot of alcohol. Youth who do drink more heavily and more often than their adult counterparts because of their physiological, they're stronger, they're younger, they can stay up. 2 drinks of alcohol would put me to sleep. 2 drinks for them, they're just getting going. They're risk-seeking, thrill-seeking, little great, I mean, that's what makes them fun because there are no barriers. That also is what makes them dangerous because there are no barriers to the amount of alcohol once they start drinking.
Joe, I don't want to slow you down too much, but I also want to point out an interesting part of this slide is that things like drinking age policy, so why we talk about the importance of policy. The US has the lowest drinking binge rate, and we have the highest policy in terms of legal drinking age.
To the countries that are compared, because there are countries that are
Right.
that way.
But people didn't stop smoking tobacco until we made tobacco policies.
Correct.
And so that's why we talk about policy. Thanks.
You're welcome. And so effects on academics. So when you have youth who are using, and I want to make sure that this is clear, that this is a causation and not necessarily a correlation and not necessarily a causation, because by the time youth reach grades 9 through 12, which is what these data points I'm about to tell you about are based on, there could be a number of reasons why youth are drinking, and there could be a number of reasons why youth aren't doing well in school. It's both substance abuse and mental health issues that, if gone unaddressed by high school, really diminish the future of our youth today. So and these are data points from across the state of Maine. 12% of students who are reporting on the MeHouse that they get A also report that they've had alcohol in the past 30 days, as opposed to 50% of students who are self-reporting that they're failing school, getting D's and F's, also report smoking marijuana or using alcohol in the past 30 days. There's a definite correlation between mental health and substance use disorders and how that ends up showing itself in our youth's academic performance in schools. There's also an incredible effect on our competitors. For those who work with youth in sports and in theater or music, alcohol use cancels your gains from your workout. It causes dehydration. It slows the body's ability to heal and rebuild those muscles. It inhibits your ability to learn new information. It hampers memory and retention. It constricts metabolism and endurance. And it requires increased conditioning just to maintain weight. And it inhibits absorption of key nutrients for your young athletes and for your young youth in general. And athletes who use, or even band members, or if you have a mock trial team, if you use and you get caught, you're also just simply letting down your team. So the question we have for you is, when, as a community, will Lincoln County decide enough is enough, and that we get together and combine forces and work towards creating an environment that fosters a drug-free development of all our youth? So while tragic car crashes make headlines, it's also important to keep in mind that only 1/3 of underage drinking deaths are attributed to automobiles. And the majority of underage drinking deaths often go unreported in news or do not make headlines as handily as the drunk driving crashes. These include suicides, drownings, falls, alcohol poisonings, and homicides. And this is not to mention that these tender and formative years are then wasted because of sexual assaults, violence, poor academic or athletic performance. And let us not forget the roots of addiction reach down into a person's early experimentation with drugs and alcohol. This isn't the way for all of our youth, and in fact, we're really fortunate that for most of our youth, this is really not the case. But for those for whom this applies, we can do something about it. Underage drinking is not inevitable, and it isn't part of a healthy adolescence. And for law enforcement in the room, this may look very familiar. For those who have yet to see photos of what an underage drinking party scene and its aftermath looks like, this is not uncommon. for underage drinking parties, whether they happen in pits, whether they happen in basements, whether they happen in a field somewhere. And what's also remarkable about this photo, and for those of you on the phone, it's a photo of pictures of what's left over for empties at a party, are the brands in this photo. For the Center for Alcohol for Marketing and Youth, the brands that are depicted in this photo are typical of the brands most used today. Drink: Sky Vodka, Coors, and Bud Light. I believe in the background that there's some really cool looking labels for beer, some Alka-Pops, Kahlua, and I'm sure, because this may not be from Maine, but if it were from Maine, there'd be some coffee branded, is what I was going to say.
We told her she had to say that.
But one of the other, and this gets at our youth are being preyed upon by big alcohol, just like they're preyed upon by big tobacco, and now they're being preyed upon by big marijuana. Advertising works, and if you were to go on the internet and look up any of these brands, you would see advertising that is not appealing to an adult. It appeals to mostly young men, especially with the Sky Vodka ads. And the advertising amount that the industry spends in the United States, the last I looked was 2005, was $6.6 billion. The budget for Drug-Free Communities grant is $500 million, which doesn't even begin to touch the $6.6 billion that the alcohol industry is spending to ensure that they have legacy users moving down the line. This is nothing short of what the tobacco industry has been called on and has been forced to pay out through their tobacco settlements money. And yet the alcohol industry, for those of you who are maybe familiar with the names of Diageo or Coors Miller or InBev, they spend not only billions on advertising, but billions in keeping lobbyists in every state house around the country and ensuring those well-paid lobbyists take out to dinner and to lunch all of our state representatives, and wherever there is smoke, there is fire. They are there to ensure that their alcohol sales remain safe at all costs. I may be sounding a little cynical, but when you see what happens at the state and national policy level around alcohol industry, you would see that our youth are at the expense of their industry success. So what can we do about it? We can do policy work, we can target supply, we can increase the use of effective parental monitoring skills, we can engage our local law enforcement around best practices for reducing youth access to alcohol and increasing their perception of being caught. We can support and complement programs that are already existing in our communities so that whatever happens in our classrooms with our kids around their knowledge of risk is supported once they walk out into our communities by what they see for advertising and what other adults in the community express to them is what's expected of their behavior. And I'm going to zoom now because I'm understanding that we are running short on time. I wanted to show you this wheel, which is the continuum of care wheel when it comes to substance abuse prevention and intervention and treatment and recovery. We all have a role to play along this continuum. Jen, you wanted to say a few things maybe about what Health in Lincoln County?
Just real quick, because, and I'm coming up here because they can't hear on the phone without me being up here. That we have a couple of programs that kind of lie in the selective and the indicated section of the wheel, and the selective would be our life skills program that covers not only, it's targeted for middle school students, that discusses not only substance abuse and how to recognize pressures and things like that, but how to respond, how to speak up, how to become a more holistic, well-rounded individual.
And then many of you in the room know about the Student Intervention and Reintegration Program, SERP. And that would be the indicated. Those are kids that attend that have already started and have been identified using risky behaviors around substances. So I'm going to
thank you, Jen.
finish on time.
So what we're talking about introducing or beefing up the effort in Lincoln County is more of the universal and the promotional type of stuff. So the universal would be the laws and the policies that affect everyone, like the minimum legal drinking age. It could be school policies that affect all the students and their families about how we react to youth who are, or how we put out strong expectations for youth to remain drug and alcohol free. It can be also whether we want to work with local retailers around what type of advertising and where they put the advertising in their stores. But then also we want to really work on promotion for both parents and families and adults who work with youth around messages that youth respond to around what there's expected of them. But not only for the youth who haven't used yet, but create a cultural norm in the community. So for those youth who are learning through selected or indicated, or need to go through the treatment for a case identification and are in recovery, we can remove some of those triggers for them in the community that would then send them back to their addicted behaviors. These types of approaches to a community-wide prevention and promotion have been shown to work not only in the other communities where we've worked in Maine, but across the country. And so what I'm talking about is the Drug-Free Communities Grant Program that then work on creating health promotion and universal policies in communities that support the work that everyone else is already doing. That includes providing information, enhancing skills, changing policies. And since its inception, the DFC has funded more than 2,000 communities across the country. 4.4 million middle school students have been affected by the Drug-Free Communities Grant programs, 6.3 million high school students, representing 36% of youth across the United States. And for those communities that have Drug-Free Communities Grant programs, they show significantly lower use rates than their communities that don't. So I'm going to stop here. We wanted to stop sooner, and I'm sorry, but we have just about 10 minutes or so for questions, comments, or concerns. So if there are any comments that have come in over the chat box, or any comments, questions, or concerns in the room? Yes.
I have just I'm trying to formulate the question in my mind, but things that are coming to my mind are, is there any responsibility of the client, patient, and the consequences that they, and decision making? Are there any connections with those three?
So I would refer back to the continuum of care. So what we're trying, yes, repeat the question. So is there any responsibility on the part of the patient or the family or consequences? And there, correct, and there absolutely are. And in working with policies, we can talk about consequences and their consequences being appropriate to the level of violation. And in return, in terms of responsibility to the individual, that would be part of their treatment approach. Taking responsibility for your wrongs is part of treatment.
It's also something that our Restorative Justice Project does.
It absolutely does. What we're trying to do with the Drug-Free Communities Grant is prevent youth from getting that far along the prevention wheel to start with. We want to prevent as many youth as possible from needing intervention and treatment and recovery services, because it's much higher rate of return on investment if we don't have to send youth into treatment and recovery. And it's also just a better quality of life for that youth and your community as a whole, because then they're contributing instead of needing from the community. Good question. Anyone else?
Joe, I would pick up on what you just said about contributing to the community, because one of the things that Healthy Lincoln County talks about a lot with our community partners is the need for economic development in this area. That poverty is a huge issue in Lincoln County, and we know that it contributes to the cycle of poverty and the cycle of domestic violence and the cycle of drug abuse that we see all the time. I don't have to tell anybody in this room that, and I'm looking at Lisa Harvey, one of the school social workers, you know this. Or Lisa Henry, I'm sorry. Okay.
She was nodding.
And I've been a home care social worker here for a long time, so we know the poverty effects. And one of the reasons Healthy Lincoln County does things like summer food service program is to nourish kids so that they come to school ready to learn and try to come in at that really early ground level. And it's that kind of approach that we're trying to foster and strengthen here in Lincoln County, also toward drug prevention. How do you get upstream of the problem with prevention efforts so that we aren't having to, field kids as they crash and burn? We want to see the treatment stuff there for them, and there's a lack of resources in Lincoln County for that too. But how can we get upstream of the problem is the question we're asking our community partners right now.
I can see the wheels burning in your head.
Well, I'm just thinking the same question I asked earlier is if you have a child who's in a family that's using alcohol and drugs, and you're trying to protect only the child, how do you do that? Because they go home with another parent treatment for those things.
Right, and so it's complicated. So the question was, if you have a child who's in a home whose parents are abusing drugs and alcohol, how do you then protect that child from not falling into that pattern? And so what we're talking about here is a change in the way the community addresses that child. And those changes take years to identify where in the system that child would plug in and how in the system we could make the most effective implementation or intervention that goes with that child. And then also the more that we can drill into a community that drug and alcohol use is not just what kids do, that it's not a cultural norm and that it's okay. I've had a lot of parents who are addicts come to me and say, I'm really glad you're here. I can't do this alone. I see it in myself. I don't want this for my kid. Can you help me? So it's a powerful moment.
Jen has a comment.
I think it's, I know I need this online. I think it's also important why we're all in the room, because we all are coming at things from a different angle. And so we may be, as a group, looking to reduce youth use, but we're coming at it from working with adults, we're coming at it from working with youth, we're coming at it with working with laws. So with everybody working together and kind of funneling it down and expanding.
Right, it's an incredibly complex problem, which takes a number of different systems and partners working in harmony together to attack it from all those angles, from the individual angle, from the treatment angle, from the restorative justice angle, in order to create that change, which takes 5 to 10 years, if not more. But what we're hoping to achieve and what the mission of the Drug-Free Communities grant is, their first goal that you must have in your strategic plan is to reduce use and over time adults use in the community. Because if you can promote drug-free youth, they become drug-free adults. It's breaking that cycle, and it takes a collaborative, comprehensive community approach to do it.
And it takes a long-term effort to do it, which is why the Drug-Free Communities program structures its funding so that if you receive an award in the first year, you don't have to compete for that for the next 5 years. You can reapply competitively for years 6 through 10, which is great because a 10-year impact in the world of prevention is huge. And so one of the reasons why Healthy Lincoln County is working with 21 Reasons is that 21 Reasons has a pretty darn good track record of helping coalitions like ours get this kind of funding to sustain a 5-year prevention effort that involves getting everyone from community sectors around the table, not to undermine individual efforts in certain communities, but to strengthen and support those and to help us coordinate and collaborate over a long period of time. So that's really why we're asking the next step, Friday, December 12th, from 8 to 9, back here in this room. We'd like to see as many partners as can make it come together for some more brainstorming and some more specific knowledge around what some of the risk factors and perceptions are here in Lincoln County from your lives, to think about how we might organize our collective resources, and to look at what some of the proven strategies of the drug-free prevention program are, so that we can begin to think about how those might look in our individual communities and how those might weave together with what law enforcement is already doing, with what restorative justice is already doing, with what schools and community groups and YMCAs and civic organizations and our churches are already doing. So one of the things we want help with too is making sure that we connect with people who represent all of the 12 community sectors that Drug-Free Communities program identifies. And I don't think we need to get into what those are today.
Not right now,
We'll do some
that's the
follow-up.
weeds, as they say.
Right.
So there'll be a follow-up email following today's presentation that we will send out to everyone who's here. Also, for those who are unable to make it, and it will include a link to watching this video so they can get up to speed where we are. But also included is a link to a SurveyMonkey asking you some really imperative questions that we need to know at this point. One is if you're willing to come on Friday, December 12th and continue this conversation with us, but then also who else you think should be involved in this conversation, and what are some, and sort of start getting you to think, what are some of the key issues? Like, we all know that there's underage drinking happening. Why that happens is different from community to community. We need to come together and find out what our local problems are here, and then come together and find out what we're capable of doing and able to do locally to address those problems. And that's the beauty of a Drug-Free Communities grant, is they're looking for local people to identify their local problems and come up with locally homegrown solutions that they're willing to support because your solution has some evidence behind it that it could work.
Why do you think no one's here?
Joe, I have a question. This is Robin. Will the meeting on December 12th be set up in the same way? People can attend via computer as well?
Yes.
Yes.
Great, thank you.
We did not get a direct invitation. We learned about it this week.
Yeah.
Honestly, we got board.
Right.
Eventually we ended with it. So everybody is like, I think it must be probably.
My sense is, Jen, you've been working pretty closely with Booth Bay. I'm sure if they're not here, it's probably because of scheduling conflicts or lack of lead time.
It's a really difficult time of year. I have talked to them and they will access the link. But it's also, it's a resources thing, you know. Coming from Booth Bay to Wisconsin doesn't seem like a long time, but it's an hour, you know, travel time. And
but I do know that the school health center in Booth Bay has been talking with us for sure, and the youth advocacy group.
Yes, we have another question.
Yeah, I understand you're wanting to get sort of upstream of this. You're looking at laws, policies, advertising, and all that stuff. I'm wondering, in addition to that, you're thinking about other services for people in need right now. So, for example, I know we have the 1221. I just learned about the life skills program. I didn't know about that. I feel like there's a complete lack of services for kids who are really struggling with drugs and alcohol and getting fleeing crimes.
Correct. So the question was, if we're looking to get upstream of this, are we also looking at on-the-ground services for youth who need it now? And that is part of the larger conversation. So what is happening in Lincoln County? How can we put our pool our resources together to meet the needs of where the needs are most at. I do know that the drug-free community funding can only fund upstream type of interventions, the universal promotional stuff. However, they do look, the federal government does look at the folks who are convening the Drug-Free Communities Coalition to be a nexus to ensure that those cross-sector conversations are happening. While the funding may not directly support that, the networking that comes from drawing everyone in those 12 sectors together has done wonders. There's been a lot of, even today, you know, the Drug-Free Communities Grant has been in operation in Portland for 10 years. And there are still people who are coming and going and in and out of meetings, and almost every meeting someone says, I didn't know you were doing that. And there's the value of coming around the table together.
Yeah, I didn't know about food bank.
Yeah,
Yeah,
it's huge.
and so that really demonstrates why Healthy Lincoln County talks about itself as sort of one partner around the table in a large coalition of partners around the table. Because every organization, every provider, we don't do direct service provision for treatment. We're not that kind of organization. We do some direct intervention. Jen's doing a great job of intervention with youth who are, you know, doing some high risk behaviors, but that's not drug treatment. So part of our goal is really getting people who are doing the range of services around the table and looking at where the gaps are and figuring out how we advocate to fill those gaps.
So I'm cognizant of time. I see we have one more question.
Yes, I'm wondering if there isn't more that maybe the local Ys could do, YMCAs, with education and training for the youth, that maybe there would be a mandatory requirement for conference in school on the damages to the brain and what the consequences are of taking some of these drugs and smoking.
So in moving forward, our next steps when we discuss the local risk factors, the process is we go through, we're identifying our risk factors, we're identifying our protective factors and our resources in the community. We are then doing a look at that as a community needs and resource and assess those to find out where those gaps are and who is, you know, most able to fill some of those gaps. And then looking at the universal promotional type of stuff for this funding, but then also as a group, looking at ways we can also fill in some of those other gaps moving forward. So that would be part of what we need to ultimately create is a plan, a strategic plan, where we are addressing our risk factors with evidence-based best strategies.
So, are you from Lincoln County?
Yeah.
So can you tell us anything about this?
So the question is, are you from Lincoln County Health? And the answer is, I've been there for a day. Jen? Yes, so it is now a little past our time that we promised that we would be done. And again, please look for an email with a survey as well as a link to this presentation. And if you could, when you receive that, forward it through to your networks so that we can contact and touch as many people throughout Lincoln County as possible with what's going on. So thank you, and I really appreciate everyone's time here today.
Terrific. Thank you very much.